Hi, so I'm going to present a 60-year-old female. She is admission day 10 for increased pain and nausea post-stage 3 breast cancer diagnosis. She arrived at the ED 10 days prior for increased pain and constipation. Her MRI showed cancer that has metastasized to her bones, and she was admitted to the floor to aid in pain control and improve constipation. She states that she wants to continue to fight and would like to go home as soon as possible, but needs her pain medication regimen under control as well as her bowels. Supportive oncology was consulted to assist in pain control and bowel movements and speak with the patient and family regarding next steps post-diagnosis. So subjectively, she does state that she has a loss of appetite, no fevers or chills. She denies weight gain and night sweats, but does state that she has increased fatigue. For her HEENT, she denies double vision, denies sore throat, denies discharge from ears and nose. Skin denies lesions and any changes or new moles. No rash present. Cardiovascular denies chest pain, edema, palpitations, or orthopnea. Respiratory states that she does have some shortness of breath with her pain, no palpitations, denies cough or sputum production. For GIGU, she denies nausea and vomiting, but she does state constipation since starting the pain medication, no diarrhea, irregular bowel movements, and she states that she hasn't gone to the bathroom for 1 week now, and denies burning or pain during urination. Neurological, she states that she does have some generalized weakness and fatigue, denies tremors, seizure activity or dizziness, vertigo, denies numbness and tingling in extremities. Mental health, she states that she's been struggling with her diagnosis and is now scared of death because the cancer has now metastasized to her bones. States that she has a good support system and does want to continue to fight. Objectively, her height and weight, she's 5'4", 150 pounds. Blood pressure 135/73, heart rate 90, respiratory rate 25, oxygen saturation 99% on room air, and temperature is 98.5. When looking at her, she does look malnourished. She looks fatigued but oriented. She's overall cooperative. Assessing her HEENT, her neck is full, trachea midline, no enlarged lymph nodes, no thyroid masses, tender or enlargements, no discharge in ears or nose. Her tympanic membrane is white. She has perla and her sclera is white. Her skin is cool, moist, and pale. Her cap refill is less than 3 seconds, and she does have some bruising noted from the hospital stay. Cardiovascular-wise, S1 and S2 are normal. She does have some tachycardia related to pain. No murmurs, rubs, or gallops heard. Respiratory, her chest is symmetrical. No tenderness or masses noted. No adventitious lung sounds. She's clear to auscultation bilaterally. Abdominal, soft but distended, hypoactive bowel sounds in all 4 quadrants. Musculoskeletal, her range of motion is intact. Her deep tendon reflexes are all intact. She has a steady gait. In neurological, she has ANO times 4. Cranial nerves are all intact. 4 out of 5 strength throughout, just some generalized weakness. So her problem list includes increased pain, constipation, and her new diagnosis that the cancer has spread to her bones. So her differential diagnosis list, since she's already been diagnosed, obviously that's her main diagnosis, but let's say we didn't know that she had stage 3 breast cancer. So some differential diagnosis would include breast cysts, but it wasn't like fluid-filled sacs that were found, but rather hard mass was found, more indicative of stage 3 breast cancer. Fibroadenomas, those are solid breast masses, but they're benign. And then mastitis, this can be confused with inflammatory breast cancer, but with mastitis, you're usually breastfeeding and your duct gets clogged. She's not currently breastfeeding. So the best diagnosis for this patient is the stage 3 breast cancer, which we just found out from this visit that it had metastasized to the bones. And this was confirmed with imaging and diagnostic testing. So diagnostic testing for this patient has already been completed. As a supportive oncology nurse practitioner, it is our job to make sure that the patient is to remain comfortable, provide supportive care, and also make sure that she's having regular bowel movements because that can become a huge issue since it's already been a week. So as for the treatment for this patient, there's both medical and psychological portions that need to be addressed. This patient stated that she loves music, so we suggested having music therapy come by daily while she's admitted. We also discussed the patient's wishes with her family. Everyone agreed that they wanted to proceed with all treatment options, give her the best fighting chance. With regards to her pain, she is already taking 30 milligrams of oxycodone every 6 hours. We suggested adding 2 milligrams of IV hydromorphone Q3 hours as needed. Since she is on narcotics for pain control, this can cause increased constipation, so we also suggested adding a bowel regimen to her daily medications. These medications include 100 milligrams of Colace twice daily and 1 packet of Miralax twice daily. If this doesn't work within 3 days, a daily suppository may also need to be added. We educated the patient that additional pain medication may make her drowsier and that sometimes cramping can happen when adding in a bowel regimen. And we told the patient to let the nurse know that if she's having any worsening symptoms, to let her know immediately. Supportive oncology is a consult service, so we just make suggestions and then the team will put the orders in. But I definitely think all the suggestions we made will benefit for her in the long run for sure. Thanks.